Hello and welcome once again to Diabetes Education Centers of America. And once again, I encourage you to get your A1C blood sugar level checked today. Not tomorrow, not next week, but today, as soon as possible. If you do not know what your A1C level is, go to some place like a Lab Express or some place where they will draw blood and do all these different tests, and they will just tell them you want to get an A1C test, and it shouldn't cost any more than $25 to $35. I pay $35, and I usually have the results within about 6 hours. They email them to me. But if you've had a physical, contact your primary care physician and ask them what your A1C level was. A lot of times they will not tell you, even if they put you on diabetes prescription medication. They're busy. They're trying to see one patient after the other. They just won't take the time sometimes to tell you. A lot of times you'll go in and get a physical, believe it or not, and they didn't check or they will not check your A1C unless you request it, because typically, I guess, an A1C test cost is an extra cost beyond the cost of a regular physical. And then another thing is this: do not let them do a finger prick test, because the finger prick test and the A1C test are different tests. The finger prick tells you your blood sugar level at this given time. So if they do a finger prick on you at 9 a.m. in the morning, that's what your blood sugar level is at 9 a.m. in the morning. The A1C test from my previous video tells you what your blood sugar is over a 3 to 4 month period. So that's what you want to find out. You want to find out how well your body is managing its blood sugar level. That's incredibly important. Do not take for granted that if you just came from a physical that they checked your A1C, because they might not have. And I talked to a lot of people who were surprised that they just came from a physical like the day before and they didn't check their A1C, and the primary care says, "Oh, well, you didn't ask for that," or, "Oh, well, your healthcare plan doesn't pay for that. That's an extra cost, or that's something that you have to request, and then we submit it to your healthcare plan." So whatever you do, get your A1C checked. This today we're going to talk about GoFundMe. I have a GoFundMe page, and that's how people compensate me for the diabetes information that I give them. It's easy, it's straightforward, and I feel comfortable with it. It's under Diabetes Education Centers of America, but I'm not really here to talk about my GoFundMe page. I'm here to talk about diabetes medical expenses. Mostly because so many people that I talk to about diabetes, and my good friend Dr. Garner, who helped me set this thing up, she talks about this all the time too. You know, people just, I can't tell you how many people have just blown me off when it comes to their diabetes. I just had a guy say to me a couple of days ago, "Well, I got to live my life." Well, do you really want to live your life? This guy is like 37, 38, 39 years old. He's probably about 6'2", probably close to 290, 310 pounds. He knows he's a diabetic. He just kind of blown it off. It's not that big a deal, and I gotta live my life, and I don't want anybody telling me how to live my life, but I don't know what his A1C is. But imagine if this guy goes blind. I mean, imagine, and I talked to him about this. I said, "You don't want to go blind, do you?" And he kind of looked at me, and he kind of winced a little bit. I mean, you don't want to go through an amputation, do you? At your age, before you're 40? I mean, is that something you really want to go through? I can't tell you how often I have these conversations with people that are so flippant about their blood sugar. and think that, well, if I go blind, I go blind. Oh, really? Well, then you need to go to GoFundMe and look at all the diabetes GoFundMe sites where people are trying to crowd fund, raise money to pay for surgery in order for them to get their eyesight back. Look at the GoFundMe sites and look at the number of sites that are dealing with people who are trying to pay for their amputated foot or leg. If you get a foot or a leg amputated, you're looking at a fee that could run anywhere from $130,000 to maybe even $200,000, depending on what part of the United States you're living in and how much work they have to do in order to remove it. If you talk to any surgical nurse, they will tell you, and I've talked to a half dozen in the last couple of years, they all tell you they spend all their time amputating fingers and toes and feet and legs. There are some people out there that have had a right foot amputated and a left leg amputated, all because of diabetes. And when that happens to you, you're going to be in for a world of complications, because now your quality of life is severely affected. If you do not have feet, especially your right foot, you're going to have a tough time driving. If I like I mentioned in my last video, I do not drive. I walk everywhere so that I can exercise. I take the bus, I take public transportation. I live in Phoenix, Arizona, and I take public transportation, and that's where you see a lot of people who are suffering from diabetes amputations because they can no longer drive. So when somebody says to me, "Well, I got to live my life," really? They really are not fully aware of what is going to happen to them. If you go to a GoFundMe site, there's people trying to raise money in order to have a wheelchair ramp built for their father or for their mother, so that because their mother just had her leg amputated because of diabetes. There are a number, and I mean a number, hundreds of GoFundMe sites that are related to funeral expenses because their loved one had a diabetic stroke and then they ended up dying, or they had a massive heart attack primarily caused by diabetes, or they had an aneurysm that forced on them by diabetes. All of these different. So one GoFundMe page, they're trying to pay for the funeral service because the father went in to get his foot amputated and had a massive heart attack on the table and died right there. He was getting his foot amputated because of diabetes. There are people that have tons and tons, hundreds of GoFundMe sites trying to pay for kidney disease dialysis. They're trying to, understand that if you have let's say your A1C is out of control, really high, beyond 9.5, 10.5, 11.5. And like I mentioned in my previous video, I've met people with A1Cs as high as 14.5. And then all of a sudden, they end up with kidney failure. Bam! So then now they're in an ambulance. They're on their way to the hospital in an ambulance. They diagnosed that, hey, it looks like their kidneys have stopped working. Let's put them on dialysis. Emergency room dialysis could cost as much as $11,000 to $15,000 for one treatment. If you end up in the hospital because of your diabetes, it could literally bankrupt you. And that's why people are going to crowdfunding sites like GoFundMe to raise money to pay for medical expenses. I mean, the United States healthcare system is what it is. We all have to deal with that. But if you're a diabetic, you don't have to have your foot amputated. You don't have to go on dialysis. You don't have to go blind. You don't have to deal with a toes or fingers or a hand or a foot or a leg or both feet or both legs, and in some cases both legs and an arm amputated because you chose to be kind of laissez-faire about your diabetes and just think, well, I'll be fine. And I meet people like that all the time. And Dr. Garner and I talk about it all the time. We figure that maybe if we talk to 100 people, maybe 20% will actually take it serious and meet with an endocrinologist. Go see a certified diabetes educator or take Diabetes Education Centers of America's class or consultation on getting their blood sugar under control. We're giving you a roadmap on how to get there. But so many people, we recognize that COVID has really made an awful lot of changes in society. Go get a physical. Go get your blood pressure checked. Go get your A1C checked, and find out if you don't be like I talked to Dr. Garner, and she talks about all these horrific situations where this woman was outside walking around in her backyard, and she punctured the bottom of her foot. We're out here in Phoenix, Arizona. There's cactus everywhere, and a little piece of cactus needle went into the bottom of her foot, and she she didn't even notice it was bleeding for a couple of days, and then she put a Band-Aid on it, and then a couple of weeks later, it didn't heal, and the lady's a little bit overweight, and she smokes. She doesn't drink, but she smokes a little weed every once in a while, vapes. And then a couple of weeks go by, and then she starts to notice her foot starts to smell kind of like rotten cheese a little bit. She takes her shoe off, and it's got a funny smell, and she's not too comfortable with that smell. So she decides to go to her primary care. Primary care sends her to a podiatrist, and the next thing you know, they amputated her left foot. I mean, just like that. That's how she found out she was a diabetic. And she just lost her left foot. Do you know how much you've got to go through in order to have a piece of your body cut off? Physical therapy, a prosthetic. My God, the medical expenses alone. She's going to have to put her house up as collateral to cover the expenses of what they charged her in the hospital. All because she did not go and get a physical. All because she did not go and get an A1C test done. It's not that difficult. An A1C test is a blood draw. It takes a couple of hours for you to get your results. Go and make that happen. Don't be kind of flippant and, I got to live my life, and I just don't care about those things, or I don't have time. Because let me tell you something. Your quality of life is everything. You don't want to have to go through that. You don't want to have to go through a situation where someone has to help you off the toilet, help you take a shower, help you get dressed. You don't want to go through all of that. If you are independent and you're able to get up and go to work, there are crowdfunding pages on the internet where people are trying to raise money just to pay the bills, because the person that got up and went to work every day got their leg amputated and they're no longer capable of going to work. You don't want to go through that. Don't just blow off diabetes as no big deal because you feel fine. You don't want to do that. I'm begging you, go get your A1C checked. You've got kids, you've got grandkids, you've got people who care about you. Don't place a loved one under the responsibility of being your primary caregiver because you were too lazy to go get your blood sugar checked. Once again, please check out my website, DECOAA1C.com, and there's a lot of information on there. Give us a holler if you want some help with your diabetes, and I look forward to doing another video in a couple of days. And once again, just have a great day, and thank you so much for watching this video.